Hello, I'm Chris Foster, and today I'm going to be presenting on the AOK Network's system approach to creating better outcomes for babies, young children, and their families. We have three objectives for today's webinar. By the end of this webinar, I hope that you will be able to explain why AOK Networks use a system approach, that you understand the difference between system and program approaches, and that you can describe AOK Network's system approach. So let's start with our AOK Network mission. All Our Kids Early Childhood Networks are community-based collaborations that promote the healthy pregnancies and the positive growth and development of all children birth to 5 and their parents or caregivers by assuring a well-coordinated, easily accessible, equitable, and just system of services and supports that engages parents as partners in making the system work for them. While the articulation of this mission has evolved over the years, what has remained and always been central is the focus on improving child and family outcomes through a systems approach. The AOK developmental pathway is our vision of the positive outcomes we seek to help babies, young children, and their families achieve. This developmental pathway describes the outcomes not only for newborns, infants, toddlers, preschoolers, and kindergartners, but also their parents. It helps us focus on what matters most to us and guides our work. However, to achieve these impacts, children and their families must achieve a continuum of outcomes over time and across multiple domains. As you know, the three impacts that we're most interested in are babies are born healthy, young children are safe, healthy, and developing positively, and children are kindergarten ready. For each of these impact areas, there are multiple domains which include many outcomes that must be achieved over time from pregnancy through entry into kindergarten that allows and enables young children to not only be kindergarten ready, but to be ready for success in life. We also know that there's a number of outcomes for parents, caregivers, and their families, that when those outcomes are achieved, that influences positively the extent to which children can reach the positive outcomes we hold for them. However, and unfortunately, not all children are achieving critical early outcomes that influence not only kindergarten readiness, but also success later in life. So why is this? Why is this happening? A lack of community coordination is one reason. We know that for children to be healthy, safe, and developing positively, they must meet a variety of outcomes. And these outcomes are all interconnected. Yet we provide services and supports as if they are not. And unfortunately, no one agency can meet all the possible needs of a child or their family. We need to support the whole child and the whole family through a coordinated community effort rather than individual service silos where each tends to focus on a specific domain or set of outcomes. From a community system perspective, rather than think narrowly about my clients or my program, we need to think more collectively about all the children and families in our community and how we can work together to support them in all their needs and all the ways that can help them achieve the outcomes that will matter most in their development, safety, health, and meeting their basic needs. But there's another reason Another reason that all children are not reaching these critical outcomes is because there are many service delivery system issues that get in the way. Even when we use evidence-based interventions, like providing developmental screenings so that we can identify early those children who may need some extra help in reaching their developmental benchmarks so that they can be ready for kindergarten, there's many system issues that get in the way. For example, agencies not referring families to other agencies that could do the screening, screenings not offered when and where families can use them, kids who could most benefit are not being screened. Some agencies do not believe it's their role to talk to parents about screening. Parents are not involved in understanding and addressing the screening access issues. Or some agencies offering screening do not use trauma responsive practices. And so it's issues like this that can get in the way of even the best evidence-based interventions that we can provide to try to create better outcomes for young children and their families. And still, there's yet another reason why often these children are not reaching their outcomes. And that's because the programmatic approaches that we use alone are insufficient to achieve a population level outcome. And what I mean by that is we want good outcomes for all children, not just some. And so we have to look at the way in which we are trying to support children and their families. So an example of this is a system issue that frequently comes up in communities is that information on available services related to the targeted problem or the problems that we're trying to solve for children and families, it's not reaching all families. Well, a typical approach that we use is referred to the program approach, and that's to do something like hold an annual resource fair to distribute service information to families. It's a program approach in that it's something that's targeted directly to affect individual children and or families. And this can be effective for the families that we reach. But because that annual fair is only offered on a certain day, at a certain time, in a certain location, it automatically limits who it can reach. But if we take a system approach, then we can think, how can we make this information available to families and to providers when they need it? So an example might be that we put processes and incentives in place for organizations to update their service directories with a local 211 call-in or web database on a quarterly basis. This helps make the information available to families and to providers when they need it, and to make sure that that information is up to date. Another part of that could be that we have providers who work directly with families adopt the practice of telling families about available services and referring them to the updated 211 resource. And so this multi-strategy approach not only permanently change how the system functions, but it enables us to reach more families. And if we want all families with young children to achieve the outcomes that we most desire for them, then we need to think about how we can use programs and systems approaches to make that happen. So to achieve their vision and to address these issues, AOK Networks improve the early childhood service delivery system so that more children and families can benefit from a holistic, coordinated, local array of services and supports. You can learn a little bit more about our approach by also viewing the webinar called Conceptual Framework, How AOK Networks Improve Child and Family Outcomes. So I want to pause for just a moment and connect what AOK Networks do and their statewide work to the work that's done by other early learning or early childhood collaboratives across the state. Generally speaking, in our state, we use the language community systems development, which is defined as community systems development is a process by which a community takes collective responsibility for the young children in their community by working together as a whole system to ensure all young children reach important outcomes across domains of health, safety, positive development, and kindergarten readiness. This is exactly what AOK networks do, though we don't tend to use this language, community systems development. Instead, we focus on system improvement. This graphic, which you'll find in the conceptual framework and other AOK materials, you might say is a vision of the coordinated service delivery system that we aspire to achieve as we do the work of the networks. So now I want to go a little bit deeper to explain kind of this system approach that we use, but I think an important starting point is to first define what we mean by a system. So I want to start with a bit more kind of general definition of system, and then we'll talk about how it applies to early childhood systems. So this definition of a system suggests that a system is any group of interacting, interrelated, or interdependent parts that form a complex, unified whole that has a specific purpose. And so there's a lot of pieces to this definition, but some of the important ideas that I want to point out is this idea that it's made up of parts, and those parts are interacting, interrelated, and even interdependent. So they're not individual separate parts, but there's a relationship that exists among them. And that these parts form a complex, unified whole that has a specific purpose. So I'd like us to think about the human body as an example of this. As we all know, the human body is made up of many different subsystems, if you will. The respiratory system, the cardiac system, the neurological system. There's all these various systems, and they all work in and of themselves as a whole, but together they work as a unified whole that has a specific purpose, which is life. None of those systems individually create life. It's only through their interaction that they create the human body, which gives rise to life. And so when we talk about early childhood systems, this is an important thing to be thinking about, because that is very different from a collection of parts as represented by this bowl of fruit. In the bowl of fruit, there are many parts, but they really have no interdependent pieces. The fruit can be easily rearranged in any order, and it doesn't change anything about the fruit itself or the bowl of fruit. It's still a bowl of fruit. It's just a collection of fruit that's been reorganized. And so collectively, there is really no unified whole or specific purpose. So as you think about your early childhood system in your community, I invite you to think about these different aspects of what defines something as a system versus a collection. First, is it purposeful? What is its purpose? For us as AOK Networks, we promote healthy pregnancies and the positive growth and development of all children birth to 5 and their parents and caregivers, right? And we do this by improving the service delivery system. All systems have a boundary, which I didn't talk about in the prior definition of systems, but there's always a boundary that describes what is in the system versus what's outside of the system. And so for us, we define it in a variety of ways, but 2 examples include that we are focused on better outcomes from birth to 5 years of age and their parents and caregivers. And then we also define our AOK networks geographically. So some AOK networks are county-based, some are multi-county based, and some are even smaller where they're focusing on a village or town. The parts of our early childhood systems we tend to talk about in terms of sectors that care about the health and well-being of young children and their families, but we could also talk about it in terms of the agencies or organizations that are involved, or the stakeholders that are involved, the programs that are involved. The interactions are, again, have to do with how the system parts work together as they function as a whole. And in many ways, we might say that this is actually the core focus of our work, because we're trying to build a more coordinated cross-sector early childhood system. How we work together across sectors, across programs, across services, this is what we're trying to improve so that we can indeed function as a system. And finally, there's always a synergistic aspect to a system. As we talked about in the example of the body, the synergistic result is life itself. When we're talking about early childhood systems, it's the greater collective impact that we can create for children and families by working together. So I want to take a few minutes now that we kind of have a general sense about what a system approach is, to talk about kind of distinguishing it from a program approach. We've kind of touched on this already a little bit, but I want to go into a little bit of a distinction between the two, and then I want to circle back to the idea that it's not an either or, but really a both and. But let's start with the distinctions so we kind of understand the differences first. And so a program approach tends to be more of what agencies or organizations that are providing programs and services, it's the focus that they take. Now, these are some overgeneralities. This is not the way all programs or all systems work, but just we're trying to tease out the differences here, so bear with me. So first of all, when we think about the focus of intervention, when we think about it from a program or agency perspective, the tendency there is to want to do what's going to change the child or family directly. We're developing programs and services that change behaviors or knowledge or abilities to improve very specific child and family outcomes. But when we look at it from a system or the AOK network perspective, we're going more broadly. And what we're trying to do there is really build or permanently change the system so that more families can benefit. So the focus of the intervention moves from the family or child directly to the system that serves the child and family. From a client perspective, as we've already indicated, the focus tends to be on the individual child or family for the program perspective, or from a system perspective, it's looking more broadly about all families in the community. When we think about outcomes, again, it's whether it's at the individual level, so individual specific children and or families, or are we looking more at the population level and considering all the children and families in our community? When we think about the needs that children and families have, we tend to think domain specific when we're working from an agency or program perspective, depending on what our work is, what sector we're in, whether it's health or mental health or family support or early learning and care. We tend to focus in on the needs related to those domains. But from a system perspective, we go much broader and think more holistically. We think about the whole child, the whole family, and we look at their needs across those domains so that we have that whole picture. In terms of goals, same thing. It's either program or domain specific, or we back off of that and we think about all the goals that might need to be met across the various programs, across the various sectors. And then we look, what's our shared cross-sector goals and agenda that we want to do in addition to our individual program or agency goals. From a strategy perspective, again, it's all dependent on what angle you're looking at it. Are you looking at a specific set of program objectives and goals and needs, and you're focusing there? Or are you backing off and taking that broader perspective to think about all the agencies, all the sectors in our community that are doing great things to support children and families? How do we better coordinate and align what we're doing so we can each continue to do the great work that we do? And by aligning what we're doing, we can actually get to better results for all children and families. And then finally, the impact is whether it's isolated on those few children and families that we contact and serve directly, or are we looking to get greater collective or population level impact that it serves more children and families? So I hope that helps kind of make that distinction and helps further clarify why system improvement of the early childhood system is critical. Of course, we'll always need the excellent, high quality programs, services, supports, and resources that are provided by individual agencies or organizations. And at the same time, we also need to use a system approach to address the system issues that get in the way of babies, children, and families reaching critical outcomes. So when we talk about system improvement from an AOK perspective, it's a broad term that we use to describe our system efforts. So whether we're engaging in a system change, system building, and or a human-centered design approach, all three are important ways that we can improve the system. And this is what we talk about kind of in the center of our conceptual framework when we talk about continuously improving the local service delivery system. So I want to say just a little bit more when we talk about improving the system. We have 4 system outcomes that are kind of our guiding focus for the ways in which we want to improve the system. And so that includes things like access to quality services. Again, there's great things happening in our communities, services, programs, supports, resources, but those services and programs will not do any good if families can't access them. So that's a critical piece of our work. We also spend a lot of time looking at coordination of efforts issues. So as we talked about earlier, if we're all working in our own program or agency efforts or our own sector silos, if we're not coordinating what we're doing, chances are more families are not benefiting from what we do have available in our community than if we can coordinate those efforts and make sure we're all doing everything we can to get all families connected to the parts of the system that can benefit them the most. Equitable and just system, I hope that that kind of stands on its own. We know that there are many families and their children who are marginalized and have disproportionate opportunities to benefit from the programs and services that are available in their community. And so it's our work to be looking again holistically across the community to make sure that what we have available is fair to all members of the community to be able to benefit from them. And so how we do this may be a big undertaking, but it's definitely worth pursuing. The 4th system outcome is what we refer to as parents as partners, and the full outcome is around this idea of parents as partners in making the system work for them. And so we know that if we're trying to make a system that's more accessible, more coordinated, more equitable and just, we can't do that unless we really understand how parents are experiencing the system in the first place. But then we also need to involve them in not only understanding the problems that they face and trying to engaged in the system, but we also have to engage them in helping figure out what can work to solve those system problems. And then we also need to keep them involved and engaged to help us figure out, is what we've tried working or not? And so involving parents as partners in the process to make the system work for them is a critical piece of the work that still needs more to be done with it, though many networks are making some great inroads with this. Again, you can see the conceptual framework webinar for more details on these system outcomes and some examples of each. So I want to just say a little bit about our assessment, planning, and action process. That's what APA stands for. Because while the system approach was kind of rolled out across these strategies, I want to take an opportunity to just re-emphasize that it's not just something we do when we assess the early childhood system, and it's not something we do just when we design strategies to address those system root cause issues that get in the way of children and families accessing services. The system approach really cuts across all the phases. Even when we start out at phase 1, when we're focused specifically on child and family outcomes, as we've already discussed, the developmental pathway looks at outcomes across multiple domains related to health, mental health, early learning and care, family support, faith-based support. All these different domains, we look at it holistically. And so a systems approach is really looking at our community and the needs of our children and families in a more holistic way. So even the the child and family outcomes assessment is a systems approach. And then, of course, at phase 4, when we're implementing our strategies and we're tracking and trying to learn what is working and then adapting as we need, that's still a systems approach, because we can never really know what's going to work. And so we need to continue to engage stakeholders and learn as we go and then adapt. And all of this really, as you'll learn in a minute, is a critical part of a systems change approach. All right, so in a nutshell, the AOK Network system approach really is consisted of 3 separate but related approaches that can be used individually or in combination. And all 3 of those approaches, which includes human-centered design, systems change, and system building, are really embedded within the ongoing process of continuous learning and adaptive action. So let's take a closer look at each of these. So human-centered design at its core is really about having great empathy for those who are experiencing the problem. But even beyond having great empathy, it's about actually engaging those who are experiencing the problem in solving the problem. And so in human-centered design, from that perspective, some of the critical questions we need to be thinking about is, how are you going to engage those experiencing the problem and solving the problem? We know that we need their perspective, and not just their perspective, but their involvement. So how are you going to do that? And across the whole process of assessing child and family outcomes, to assessing the system and identifying root causes, to designing strategies that we hope will do the trick, as well as then when we start to put it into place and implement it and learn kind of what is and isn't working. We're going to need to know from families what's working and what's not working, because ultimately it's for them. We also want to think about, because it is hard sometimes to engage families in that whole process, though not impossible, we have to be thinking about how people experiencing the problem would solve the problem. So we mostly want to engage them in figuring it out together. But if that's not always possible, we minimally need to think about, from their perspective, and this is where the empathy comes in, well, how would they solve this? And we can also think about the specific needs and circumstances of those experiencing the problem, and how that can be addressed in our strategy design. So it's going beyond just how would they solve it, but it's also thinking about, well, what is it like to be those families who may be not reaching critical developmental outcomes for their children, but also looking at, well, what else are their needs? Are they living in poverty? Do they have living wage jobs? Do they have access to food? Do they have transportation to get themselves to services? These are the kinds of needs and circumstances we also need to be considering as we think about our strategies to solve the problems that people are experiencing. Here's an example from Stevenson County of their work to engage parents in the whole process. And you'll see from this promotion that they're recruiting parents and caregivers to help design services and to become a community leader and really work through that whole process that we've just been talking about. This is what we mean by human-centered design. Now I want to talk about the other two complementary system approaches. One is around system building, which is around more focused on developing or building up of structures, processes, behaviors, and connections so that the system works as a whole, going back to our system definition. Because in many places, agencies and sectors are working more independently, and that causes problems for children and families. However, a systems change approach takes a little bit different of an angle on this, and that's more focused on altering the status quo, the way things are currently working. And they do this by shifting and aligning system parts and their interactions so the system acts in new ways. And so we tend to think about an either or, it's either system change or system building, but in fact, both can be very complementary to the other. So whether you start with one, the other can be helpful, and vice versa. So for example, sometimes when we identify what's not working in a system and we want to try to alter that, we can begin to make those changes to shift what's not working. But part of it may be that we realize that there's something missing. Maybe the way we're doing referrals right now is not working very well because we lack a coordinated system. And so we decide to build that coordinated system together. On the other hand, we may start out already knowing that we don't have a good information and referral system. So we set out to build a good one. But then once we get it built, we find that people aren't using it. So then we need to also engage in a system change approach to figure out, well, why is that happening? What is it that needs to change so that more people will engage in that particular referral process? So we've already talked about this a little bit in terms of system change targets, system barriers. And so we use this example with developmental screenings. And just remembering that sometimes, even when we're using very good evidence-based approaches or strategies to create the outcomes that we most care about, often there are system issues that get in the way that relate to access or coordination or equity or parents as partners, as some of these examples illustrate. A system change approach seeks to influence how people in the system behave in every community to whatever degree the system is formal or informal. There are a set of practices and habits that are in place. And so often those practices and habits are not what we need to best support children and families. So being able to adapt and change the way we do what we do can be a powerful way to change the system. We can also influence how the system is structured and how it functions. And again, in a general speaking, we try to do this by better aligning our efforts or better coordinating our efforts so the whole system, again, functions as a whole and makes it easier for families to access and get to the services and programs that can benefit them. Now, a system building approach is a little different, as we discussed. And when we talk about system building from an AOK perspective, first of all, we think about it in terms of early childhood system components. And since the beginning of AOKs, these system components have pretty much always been part of our work, part of what we aspire to as we build a better early childhood system. And so we've called these different things over the years, but in essence, they're key aspects of the system that are critical to being able to function as a whole and to better meet the needs of children and families. These are probably familiar to you, so I'm not going to take a lot of time today to talk about them. You can find better definitions for these in the Conceptual Framework 3-pager, which defines these, as well as some of the other on-demand webinars. But know that these are a critical piece that guides AOK Network's work, whether you're looking at it from a system building or system change perspective. These can be important lenses to be thinking about. When it comes to system building, we also are very keen on looking to best practices from other places. While we know that what works in another community is not necessarily going to work in ours, we can look to other best practices in other places, especially places that are similar to ours, and we can learn from their experiences about what worked, and then we can think about how we might have to adapt that to fit the local context that we're working in. We also believe that it's critical to build on local strengths and assets. We've used appreciative inquiry and asset-based community development processes to make sure that we're not only looking for the problems, but we're also building on the strengths and assets. And then finally, we also know that as an AOK Network early childhood system, we have a boundary around our work that says that we're primarily focused on what affects young children and their families. And so often, though, there are issues that are outside the scope of what our primary mission is. So, for example, we may discover that there's transportation issues that get in the way of children and families being able to access services. But to change the transportation system is really outside the scope of our system work. So in those cases, that's where we want to collaborate and align what we're doing with other local efforts that may be more specifically focused on issues like transportation. So let me give you a couple examples. As you all know, one of your initiatives right now is on information and referral. While not all of you are using the IRIS system at this time, information and referral is one of our system components. We believe a good information and referral system is critical to a well-functioning early childhood system. And so many of you, all of you actually, have an initiative focused on this. And while some of you are looking at the IRIS system for a new system in your communities, others are looking at the local information and referral processes and practices and looking to see how you can enhance and make that better through both maybe a systems building and a systems change approach. Here's another example of information and referral that kind of crosses over. Not only is it a system building effort, it's also related to a child and family problem that was identified through the Child and Family Initiative. So in this case, this comes from Stevenson County, they had identified a targeted problem that not all infants are safe. they identified a number of system problems related to access. One of those issues is that mothers experiencing postpartum depression who score a 10 out of 30 on the Edinburgh screening are not accessing services to deal with postpartum depression. And through some deep work of understanding this issue, one of the things that they decided to do was to design a decision tree and to get more information out to um, mothers who were experiencing postpartum depression so that they can help improve their access to services. Here's another example focused on early identification, and this comes from Will County. They identified that not all toddlers and preschoolers are developing positively, and they also identified some system access issues that were getting in the way of better supporting those toddlers and preschoolers to develop appropriately. And so one of the system issues that they uncovered was that the community didn't have a consistent or positive way to promote the importance of routine developmental screenings and how to get them to families, especially those who are not currently engaged in the early childhood system. So what they decided to do is collaboratively, they produced a video targeting families with young children to help them better understand what developmental screenings were and how it could help them better support their child's development. And so you can find this by Googling the Will County Health Department, the AOK networks. So finally, I just want to come back to this idea that continuous learning and adaptive action is pervasive across all our AOK efforts. And so whether we're engaging in a human-centered design, system change, or system building approach, we're always using continuous learning and adaptive action to continually make our efforts more powerful, effective, and scalable through these small scales or cycles of preparing, implementing, learning, and adapting. And so these cycles may be just a few or they may be many. It really depends on what we're up to. But as an example, we may be providing training to providers to help them better understand, let's say, how to uh, do good referrals, right? And so initially we may want to develop a part of the training, so we need to prepare it, and then we might implement it by just sharing a portion of the training with some of our targeted audience just to see how the language is or how responsive they are to the training element. But then we'd want to reflect on that and learn, okay, so what seemed to resonate, what seemed to work, what input did they give us about how it could be refined to better meet providers' needs. And then we figure out, how do we need to adapt that then? What are we going to do differently as we continue to evolve the rest of the training? And then we might then go into our next cycle where we prepare the rest of the training. We then implement the full training with a small group of providers. We use it as kind of a pilot, if you will, or a prototype. Then we reflect on that after and gain some feedback from them again about how that went, what they thought, how could it be improved, or what was good about it the way it was. And then we decide, are we going to make any further adaptations before we move into our next cycle, which might focus on beginning to offer this training to a wide variety of providers at different times and in differing ways. And so you can see how we can kind of scale up in small ways so that we can learn what's working and so that we can quickly adapt before we scale it up. So there's lots of ways to use continuous learning and adaptive action in our efforts, but I hope that example helps illustrate at least one way and one reason why it's important to continuously employ this kind of action learning in our work. So the pilot process is what we call the prepare, implement, learn, and adapt cycle. And again, it's the core cycle of our continuous learning and adaptive action approach. And just real briefly, I just want to touch on this again. To prepare is what we do when we get ready to implement strategies. So before we even go out and start delivering the training, we have to design the training, right? We have to get ready. We may have to design an evaluation. Then we can implement it or take action on our strategies. And then while we're doing that, we also have to think about if there's an implementation aspects that we need to support. And that's for another webinar to get into that more deeply. But basically, with implementation, we're taking action and we're keeping track of how it's going. And then in the learn phase, what we're really doing here is first we're reflecting on what's happening or what has happened with implementation. And we're learning what worked, what did not. And then we move on to the adapt phase where we identify what, if anything, do we need to change and or what's our next steps before we start the whole cycle over again. So I hope that this provides a little bit of a sense of how we're thinking about our system approach. But to make it even more concrete, I want to offer these core system thinking and continuous improvement practices that are really woven throughout our process as we seek to understand the problems that children and families are facing, understand how the system is not functioning in a way that helps us support those children and families and reaching the outcomes that are important. And then as we design our strategies and implement, here are some of these practices. So engage stakeholders throughout the process. We talked about that a little bit already today. Keep the vision and desired results in focus. Understand the big picture and the interconnectivity of problems. Identify powerful system leverage points for change. And what I'm talking about there is root causes of certain types. Design and implement strategies that focus on root causes. Create the conditions for effective implementation. And continuously learn and adapt until you discover what works. And again, we go into more detail on these in the Child and Family Initiative Assessment Planning and Action Process. So if you'd like to learn more, that's the place to go. So finally, the last thing I want to touch on before we wrap up is again, just this idea that network capacity is critical to system improvement efforts. As you know, trying to improve the service delivery system is something that can't be done alone. It can't be done by a small group of individuals or one or a few agencies or even a few sectors. We really need to work together in order to be able to make the kind of system improvements that we've been talking about. And so our network capacity is critical. We need to be able to develop our collaborative capacity in core areas such as having a shared agenda and goals. If we're not all focused on what it is that we can do together, it's going to be really hard to move into action together. We also need to consider a collaborative leadership engagement. Are we all able to contribute in ways that get to that synergistic result that happens when we all contribute what we can and that we all show up as leaders around the table, making those contributions and working together with each other? Continuous learning and adaptive action, we've talked about today in terms of the process of improvement, but we also need to be able to hone our skills in doing continuous learning and adaptive action, because the better we get at identifying what's working and not and adapting appropriately will help us be more effective in the long run. And then finally, network governance. We need to establish the function and structure and practices that are going to enable us to work together well towards the health and well-being of families with young children. And so there's a number of resources available that help break down these 4 core areas into a number of different elements that make them even more concrete to think about. And especially when you think about your network capacity initiative, you're going to want to think about these 4 areas and think about what's needed at this time to help build that collaborative capacity. because we have to remember that our capacity will ebb and flow over time. We can be working at really high capacity at one point in time, but then something shifts, something happens in the community, funding is lost. Different kinds of things can contribute to a decline in our network capacity. So we always have to keep focused on this, and we always have to give effort to not only improving the system, but improving and enhancing our capacity to create those system change so more children and families can benefit. So in summary, I hope that today this has been more clear the way that AOK networks use a system approach to address the holistic needs of children and families, to better address the system issues that get in the way of accessing services, and that we can use a complementary program approach so that more families can be served. I also hope that a program approaches, we understand now that they seek to directly influence child and family outcomes, while system approaches seek to improve the system so that more families and children can benefit from the programs and services that we offer. And finally, AOK Network system approach is woven throughout the assessment, planning, and action process and includes human-centered design, system change, system building, and continuous learning and adaptive action. I hope you found this webinar helpful, and I thank you for your time.